Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.
It's just heartbreaking and unprecedented.
Coronavirus doctors at war with little ammo.
60% of the nation's blood supply comes direct from local businesses, churches, high schools, and college campuses.
Businesses and churches are now closed, and blood donations are way down.
It's going to be something we've never experienced before.
Louisiana tourism on hold, millions being lost. Hi, everyone. I'm Natasha Williams.
And I'm Andre Morrow. We are on day 13 of a stay-at-home order of Governor John Bel Edwards because of the coronavirus outbreak. The state's cases now pushing to over 10,000 people, with 370 deaths as of today.
The governor addressed the state this afternoon, as he does daily.
We knew and have been telling people for a long time that getting through this crisis would resemble a marathon, not a sprint. So I'm again asking people to be patient, to stay in their homes, and take the stay-at-home order seriously. Your neighbor's life depends on it, and quite frankly, so might your own.
We'll have more on the governor's news conference in just a moment.
But first, a look at some of the other stories making news across the state. Senator Bill Cassidy announced this week the federal government is fully funding the Louisiana National Guard's efforts to combat coronavirus. About 1,200 guardsmen are assisting with disaster relief efforts, like assisting with testing, food prep, delivering supplies, and setting up emergency shelters. Texas became the first state to extend a mandatory self-quarantine to Louisiana drivers crossing into the Lone Star State. It began Monday, but with few signs of how Texas was enforcing the order. Texas Governor Greg Abbott then began beefing up the patrols of state troopers to stop anyone with Louisiana plates. A few states to our east, Florida also expanded a quarantine order to include Louisiana. Governor Ron DeSantis, who had allowed Florida beaches to remain packed during spring break, says Florida Highway Patrol and sheriff's deputies will monitor travelers, stop them at checkpoints, and screen cars from Louisiana. This week saw a pastor from the city of Central arrested for ignoring orders to keep crowds away from his church, but he was not taken into custody. More than 1,000 worshipers continue to pour into Life Tabernacle for any service held there. Reverend Tony Spell is accused of violating the governor's order at least 6 times over 2 weeks. State lawmakers returned to the state capitol Tuesday for a short introduction of last-minute bills, but they didn't stay long. That was the last day they could introduce legislation for the regular session. Legislators distanced themselves in the House and Senate chambers to read in those bills. Representative Ted James from Baton Rouge tested positive for COVID-19, battled pneumonia and was in the hospital, but announced Thursday he was feeling better and going home. He will remain in isolation at home while he continues to recover. I'm at South Baton Rouge Presbyterian Church, and to show you how the coronavirus has changed things, as we all know it has changed many things, there was a funeral this morning for the wife of the assistant pastor, Woody Markert. She died non-related to coronavirus, but the virus did definitely have an impact on what happened at the funeral services because no one was allowed inside the church except for the immediate family for the services. And what the congregation, as you see, is trying to do is offer their love and support is they're doing a drive-by greeting since they couldn't be with them as they typically would be. Now let's go back to some of the briefing from the governor today.
That includes what the models they are using say about our COVID-19 rates and if we follow the stay-at-home orders.
Everybody can do better, but if we did adhere in a real positive way to the current orders around sheltering in place, keeping the schools closed and that sort of thing, we would be down along the purple line. And so where we are right now is somewhere between the worst case scenario and the best case scenario. But to the degree we get compliance, we start moving and keep moving and get closer to the best case, and less people will die. That it is really that simple, because sometimes we can kind of lose ourselves in the numbers and the graphs and so forth. But to the degree that people comply with the orders, then less people are going to die.
Dr. Rebecca Gee, former state health secretary and now CEO of LSU Healthcare Systems, tells me she has searched high and low for basic supplies for doctors, staff, and patients, and no luck. We talked this week about what's facing people in a world of COVID-19. How would it be as a doctor for you to go into a medical setting where you're taking care of a patient, but you don't have the tools needed to give the care that you need to give?
It's just heartbreaking and unprecedented. You know, I was in New York City on September 11th of 2001 and saw the second plane hit the World Trade Center, and was part of the efforts as a medical student to help ready the healthcare system for the needs of the patients of the city of New York. And, you know, that was a situation where we had tremendous tragedy, but we had the resources to handle that tragedy. I mean, here is a case where we have a tragedy, and unfortunately, Louisiana is the bleeding edge of this problem for the nation. And we are going to be, along with Washington State and New York, one of the first states that run out of resources. And our healthcare workers are going to be left with decisions of who lives and who dies. I mean, the governor has asked for 12,000 ventilators. President Trump told him yesterday he's sending 150. I mean,
but that's
you don't
not
have
enough.
A ventilator. If you don't have a ventilator and you're a doctor and someone isn't breathing, that person will die. So I mean, this is really serious, and the nation has not, was not prepared for how quickly this spread, and is not prepared either for the manufacturing capabilities of ventilators. I've spent the past week trying to source these; they're just simply not available. Just imagine dealing with the tragedy of patients dying alone without their loved ones, and in addition, being asked to reuse your mask, reuse your gowns, wipe down your gowns, fear of not having enough protection. We're sending these medical soldiers into battle without the armor they need to protect them, and without the weapons, i.e. the tools to fight this battle, which are the ventilators and critical care needs. And our nation is engaging in efforts to ramp up, but these are too late for areas that are going to run out of ventilators, and that's what the governor and my former staff members, who are extremely capable at the Louisiana Department of Health, have said will happen without those ventilators. And this week, it just, after working all the chains, the national supply chains, the private industry trying to work this problem through organizations like N95.org, it simply does not appear that these ventilators are available. At times like this, we can get we have new solutions to problems that we never would have envisioned, and we also have, opportunities to create a new connection. So there's a lot. And the positive is that of all the people that are helping each other and doing the best they can, the negative is that this is a problem that simply is overwhelming this world in a way that not only this country, but this world in ways that we've never experienced and hopefully never will again.
Rebecca, good to talk to you. We'll talk to you again. Thank you so much.
Thank you.
And a problem that did not have to be this way. Besides her work as a public health leader, Dr. Gee has a medical practice and a family to look after, so she knows crisis management. And when data showed a grim outlook for patient care in New Orleans, she scrambled into action with a call for volunteers. The result, a partnership between LSU and the UL system and a team of software engineers at UL Lafayette to develop the COVID-19 volunteer management system. The system that researchers developed in 5 days allows college students majoring in healthcare and non-healthcare to sign up and almost immediately give their support. And it doesn't leave out current or retired health professionals either. Dr. Ramesh Kallaru is UL Lafayette's Vice President for Research. The LSU-UL partnership he and Dr. Gee forged quickly became a statewide hookup.
Rebecca and I reached out to the president of the University of Louisiana system, Dr. Jim Henderson, and she began working with Dr. Larry Oye and the leadership of the LSU system, because between the two university systems here at UL system and LSU system, we covered the geographic footprint of the state of Louisiana. We immediately co-opted Dr. Kim Hunter Reed, the Commissioner of Higher Education for the state of Louisiana Board of Regents, so that we could also expand this to include community technical colleges, because we have strong nursing programs throughout the community colleges, and we wanted to reach out to them. And simultaneously, as we were doing it, Rebecca reached out to Tulane, and Dr. Fitz and the leadership at Tulane was firmly on board. And so we brought all of the leaders of higher education, because look, at the end of the day, while we educate these students at our universities, our goal is to develop the next generation of leaders who care about those communities, leaders who engage in our communities, and our students have always led from the front.
In the days following the blows from Hurricanes Katrina and Rita, students jumped in wherever there was a need, and it seems they're doing it again. Remember, this website to reach volunteers has only been online a matter of days, and already almost 3,000 have signed up.
So this just seemed like a natural way to tap into the passions, the spirit of volunteerism, and what we do very well in Louisiana, neighbor helping neighbor, in good days and certainly in times of need. And so we put this infrastructure together, and when the governor made a call to all students and so on through his tweet, and a campaign working with the Louisiana Department of Health, it just seemed like students responded to that call in a big way.
So big that more players had to get involved.
It was also equally important for us to not only look at this from the supply side of volunteerism, but from the demand side. Where were needs that were becoming visible and available, and what needs these students would be able to fill. And to make that happen, we partnered immediately with Volunteer Louisiana, which is an initiative that is run out of the Lieutenant Governor's office, and the United Ways of Louisiana, which are really, during good days and bad, the United Ways are our community in each of our communities are really the anchors when it comes to helping communities.
Ramesh, some of the logistics. Who's going to coordinate all this, and to where they go? Where will they stay? How will they be fed? Some of the basics like that.
We are working with what I would call channel partners, if you will. So all the non-healthcare volunteers that come from broad disciplines like communications and social work and marketing and business and entrepreneurship, helping any of those kinds of areas, we are going to connect those through Volunteer Louisiana, and these, in all likelihood, will. If I could step back, when we register these students, whether they were healthcare students or non-healthcare students, we ask them what types of services do they want to get involved in, what type of volunteer services would they want to get involved in, and also ask them, do you want to get physically deployed, or do you want to do this from the comfort of your homes as you're socially distancing? And Andre, I'm pleased to tell you that more than 70% of the students that volunteered said they will jump both feet in. They will go and get deployed where they need to be deployed. And that surprised me, because I would have thought that in the context of COVID-19, people would be apprehensive. Yes. Again, that speaks volumes to their spirit of volunteerism, but we want to make sure that we don't put them in harm's way.
We'll continue to talk to you as this evolves. Thank you so much for your time. I appreciate it.
Thank you, Andre, and thank you for all that you are doing to get the word out. We really appreciate you.
Everybody, here is that website. It is COVID-19 LAvolunteers.org. Remember it.
As the coronavirus pandemic has grown here in the the U.S. blood drive cancellations have grown too at an alarming rate. Officials with the American Red Cross say nearly 3,000 blood drives have been canceled across the country due to concerns about social distancing. We talked to officials at Vitalent Blood Services to find out what they're doing to try to continue collecting the much-needed blood during this medical crisis. There's no way to sugarcoat it. Blood donations are badly needed.
So we are down. The demand hasn't increased much, but the supply is depleting. Normally, we keep a 4-day supply of platelets and all blood types on our shelves. We're down to about half of that right now. And to combat that, we are setting up emergency blood drives all around the Baton Rouge, Lafayette, and Morgan City area.
Adam Fontenot is donor recruitment supervisor for Vitalent Blood Donation Center. He says these blood drives and the donors that come out are critical to replenish the life-saving blood needed in all types of emergencies, especially during the COVID-19 pandemic.
We had a blood drive at Our Lady of Mercy Catholic Church here in Baton Rouge, and from 9 to 3, we saw over 50 people come through our doors. They all had set appointments in 30-minute time blocks to mitigate crowd control and social gathering as well.
Fontenot says staffers are taking extra steps to make sure those trying to help others stay healthy.
Our staff is, they're taking all of the necessary precautions. It's taking a little longer than normal to donate blood right now because of all of the cleaning. We're having to use a much bigger space than we normally, would need to, so that everybody can, be 6 or so feet apart.
He says they're doing their very best to make the process as streamlined as possible by allowing donors to complete most of the paperwork before they come to give blood.
So everyone is signing up online. They're also doing a fast-track health questionnaire, so they're going to be deferring their own self, basically, if they have been through any one of the number of countries that have, been majorly affected by this virus. So they're going through a full biometric screening with our staff as well. So before they actually sit down, they're cleared to donate and they are fully healthy as well.
Fontenot says giving blood has been established as an essential service, and by giving your donation, you could be saving lives during this unprecedented medical emergency.
The reason that we're having such a blood shortage is 60% of the nation's blood supply comes direct from local businesses, churches, high schools, and college campuses. So, 3 of those 4 have been completely shut down for the time being. And now most of our local businesses that were scheduled for having a blood drive on the books are now either down to essential staff or have completely closed as well. So now we're having to rely on going out into the community at churches that have a parish hall that don't mind us coming in for the day, that they have an email listing that they can blast it out to their entire congregation or parish.
Blood donations are badly needed. Please donate if you can. A local hotel owner is doing his part to help those battling the deadly coronavirus. Raj Patel got an idea after a conversation with a friend and turned that conversation into action. We talked to Patel, whose plan could help prevent families of first responders from getting sick. Raj Patel is a hotel owner on a mission.
I have a doctor friend who helped me come up with the idea or the initiative to start this particular program. He was basically sleeping in the garage trying to keep his family, wife and kids safe after working an entire day at the hospital.
Patel's friend is a doctor on the front lines in the battle against the coronavirus.
So I figured in order to help the helpers, let's go ahead and provide rooms so they can get some comfort and some good rest so they can go ahead and do the work that they do at the hospitals again the next day.
Patel took his idea to Oyo Corporate and they all agreed they wanted to help. All Oyo hotels in the Bayou State and more than 300 nationwide are now offering free rooms to first responders.
They have to provide the proof of identification, notifying that, showing that they are first responders, and they can make a reservation for 5 consecutive days, take a 2-day break, and then again 5 consecutive days, and it'll go on for as long as they need it.
Those 2 days are used to deep clean the room used by the first responders, keeping them and other hotel guests safe.
We have dedicated sections at each of our hotels, just dedicated to first responders, keeping them away from the regular customers. All of our hotels, we're following the CDC guidelines to keep them nice and clean and disinfected.
Patel says this is just his company's way to give back, something we should all try to do.
It feels good to be part of a solution I'm not saying that, what we do is going to be enough, but I'm hoping that this motivates other hoteliers, other individuals to go ahead and take the initiative to help out in whatever, manner they can.
Oyo hotels are also dropping off Subway sandwiches to first responders at testing sites. They just want to do whatever they can to help those working hard to keep us safe. Tourism is a billion-dollar industry in the state, but with the coronavirus pandemic, many planned trips to the Bayou State and popular spots like New Orleans have been canceled. But Lieutenant Governor Billy Nungesser says they're already working on plans to ramp up tourism as soon as COVID-19 is behind us. New Orleans almost never looks like this. Streets empty, bars and restaurants closed, tourism at a standstill. Lieutenant Governor Billy Nungesser says the coronavirus effect has been nothing short of devastating.
It's going to be something we've never experienced before. After a hurricane or a storm or a flood, we gather up and go back to work and get people to come back and enjoy Louisiana. The whole country is shut down. So we're going to be scrambling right after this event is passed to get people back in our bed and breakfast hotels, swamp tours.
The lieutenant governor, who serves as the state's tourism czar, says his office will begin to push to get tourism dollars flowing again right here at home when the virus threats are over.
One thing we're going to focus on is Louisianans getting out and supporting staycationing, something we promoted for the last several years, and ask those Louisianans to share it with their friends and family around the country. So we will start locally in promoting tourism right out the gate.
He says our tourism challenges come after record-breaking tourism successes.
$1.9 billion, our largest increase ever in tourism. The last year we have numbers, 2018. That's over $1,000 per family in taxes that you and I didn't have to pay. We got a long way to go to catch that up. It's also devastating. We could see a third of the restaurants closed down. That is what makes Louisiana special, our food, our culture, as well as a lot of the private businesses that rely on tourism.
Nungesser says the state has fought back from tough times before, and he's confident we can do it again.
We've come together, Katrina, the oil spill, the 2016 floods. Nobody does it like Louisians. We reach out and help our neighbor. We're going to have to dig deep and really do that again.
The lieutenant governor says our journey back won't be easy, but Louisianans are hardy, and our love for our state will make us fight to get back to normal.
I'm confident we'll come out of this thing bigger and better than ever, but there's no light at the end of the tunnel yet, and we're hoping to see that in the next 30 days, and then we can get back to work. But it's going to be a trying time for the whole country, and Louisiana is going to be no different.
Beginning this Tuesday, LPB will broadcast the first of the two-part series, The Gene, An Intimate History. It's the Ken Burns documentary that brings to life the story of today's revolution in medical science. Science and personal stories bring together the history that has made today's genetic breakthroughs possible. Over the past 2 weeks, we've been sharing the importance of genetic research among our Cajun population. Now, Chris Durrance is director of the show, and he joins us for a brief discussion. Chris, welcome to you. First, I have to ask, why is The Gene such an important documentary?
Well, thank you so much for having me. We're speaking, obviously, in the middle of a pandemic. It's affecting
Yes.
Louisiana, affecting so many states, affecting much of the world at the moment. And I think people have to know that this virus is made of genes, and made of genes just like us. And so everything we need to know about how it's transmitted, how it works, why it makes some people just have a mild cold, and some people, have their lungs collapse and force them into intensive care or even take their life. I mean, all of that knowledge is going to come from genetics. It's going to come from the work of scientists. And that builds on decades and decades of research of trying to understand polio and trying to understand AIDS and trying to understand even the flu and the common cold. And so what we're going to hope now is that the scientists bring all that to bear to tackle the crisis that we're in the middle of.
Yeah.
The film tells the story of how we got to today, how we got to the point where we can bring this whole armamentarium to tackle this.
Well, let me ask you quickly, what was the most surprising content, perhaps, that you discovered in your work?
For us, I think the most surprising thing was seeing the dedication, the curiosity, the ingenuity, and the passion of the scientists who work in this field. I mean, this really is an inspirational group. And for your viewers who've been following what's been going on with the pandemic, who've probably seen Anthony Fauci,
yes,
leading the effort really to help people understand the extent of the crisis and what's being done to combat it. I mean, there are people like him all over the scientific community. And what we try and do is bring stories like that to life in the film. And I think people are going to find a newfound respect for scientists, for the work they do.
Yes.
And are really looking to them today to tackle this.
Well, it's something we can't wait for, look forward to it, and it's great to talk with you. Chris, thanks so much for being here with us. We appreciate it.
Thank you.
You take care. Now you can chat with Mr. Durrance, a Louisiana genetic researcher, and get a sneak peek of The Gene and Intimate History online this Monday at 7 p.m. Visit lpb.org/thegene to register. You can also view the two-part series on LPB. It begins Tuesday, April 7th, also the 14th, both at 7 p.m.
Legendary New Orleans musician Ellis Marsalis Jr. died this week. He battled pneumonia brought on by COVID-19.
Now, he had 6 sons, including 4 well-known jazz musicians. Branford Winton among them. He was an educator who taught generations of jazz musicians.
LPB Louisiana legend Ellis Marsalis Jr. was 85 years old.
And everyone, take care out there. That is our show for this week.
Good night.
Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.